Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. Shalom, Om Swastiastu, Namo Buddhaya, dan salam kebajikan. Yang terhormat Project Manager Webinar Nurdia Lestari, yang terhormat Founder Mediafisio.id Ilham Patria, yang terhormat narasumber Associate Profesor Ahmad Munir bin C. Muhammad dari Advanced Medical and Dental Institute University Sains Malaysia, dan yang kami banggakan seluruh peserta webinar pada hari ini. Segala puji bagi Tuhan Yang Maha Esa yang telah memberikan kita rahmat dan hidayahnya sehingga kita dapat berkumpul dalam acara webinar pada hari ini. Hadirin yang kami hormati, perkenalkan, saya Raihani selaku Master of Ceremony dalam acara webinar dengan tema Effective Exercise for Tackling Metabolic Syndrome. Selanjutnya, saya akan membacakan susunan acara pada hari ini. Yang pertama, pembukaan. Yang kedua, acara inti, yaitu penyampaian materi, dilanjutkan sesi tanya-jawab. Yang ketiga, penutup. Memasuki acara yang pertama, yaitu pembukaan, mari kita buka acara webinar ini dengan berdoa masing-masing dalam hati. Berdoa dimulai. Berdoa selesai. Berikut akan saya bacakan tata tertib webinar. Demi kenyamanan dan kelancaran acara webinar, maka setiap peserta hendaknya memperhatikan tata tertib yang telah ditetapkan sebagai berikut. Yang pertama, peserta diharapkan sudah masuk ke dalam meeting room 15 menit sebelum acara dimulai. Yang kedua, peserta wajib menggunakan nama sesuai dengan nama saat mendaftar. Ketiga, selama berjalannya acara, peserta wajib untuk mematikan mikrofon dan menyalakan kamera. Mikrofon dibuka kecuali jika ingin mengajukan pertanyaan pada sesi tanya-jawab. Keempat, peserta diharapkan menjaga perkataan baik verbal maupun non-verbal saat di dalam diskusi dengan tidak menghina dan merendahkan peserta lain maupun moderator. Kelima, sistem bertanya dengan menyebutkan nama dan mengirim nama lengkap dan pertanyaan. Sebagai contoh, Nabila Intan dan pertanyaan pada kolom chat Zoom kepada admin pertanyaan dan akan diperbolehkan berbicara setelah dipersilakan oleh moderator. Keenam, peserta yang bertanya wajib memperkenalkan diri dengan menyebutkan nama dan bagi 3 penanya terbaik akan mendapatkan door prize dari panitia. Ketujuh, peserta diharapkan tidak meninggalkan seminar dan mengikuti rangkaian acara hingga berakhir. Kedelapan, seluruh peserta diwajibkan menjaga berjalannya acara dengan kondusif. Sebelum memulai materi, saya akan memperkenalkan moderator kita pada hari ini. Nama lengkap, Zizi Triana, pendidikan Universitas Esa Unggul pada tahun 2015 sampai dengan 2019, pengalaman kerja di Fisioterapi 2019 sampai dengan 2020, saat ini sedang freelance di Indo Home Care. Selanjutnya, pemaparan materi oleh Associate Profesor Ahmad Munir bin C. Muhammad yang akan dimoderatori oleh Saudari Zizi Triana. Kepadanya, saya persilahkan.
Terima kasih kepada saudari kami, selaku host yang telah memberikan kesempatan kepada saya pada malam ini. Pertama-tama, izinkan saya menyapa sejawat fisioterapis. Assalamualaikum warahmatullahi wabarakatuh. Serta saya ucapkan terima kasih yang hadir pada malam ini untuk seluruh peserta. Sebelum acara ini dimulai, saya perlu ingatkan bahwa pemaparan materi akan berlangsung selama 45 menit dan akan ada sesi tanya-jawab selama 15 menit. Kepada sejawat fisioterapis yang hadir pada malam ini boleh sambil menyimak dan mencatat materi serta dapat menulis pertanyaan pada kolom chat di bawah. Pada saat ini, banyak terjadi peningkatan yang signifikan pada sindrom metabolik akibat adanya obesitas, diabetes, dan hipertensi. Ini didefinisikan sebagai ketidakseimbangan antara produksi dan inaktivasi spesies oksigen reaktif yang memiliki peran patofisiologis utama dalam komponen penyakit. Nah, pada kesempatan malam ini kita akan membahas exercise pada proses patofisiologis dalam penurunan faktor utama yang terjadi pada Metabolic Syndrome. Okay. Okay, everyone. Today we are going to be talking about effective exercise for tackling metabolic syndrome with Professor Ahmad C. Muhammad. And please welcome to Prof. Ahmad Munir as a special speaker from University Science of Malaysia. Hello, Prof. Good evening.
Yeah, good evening. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. My name is Zizi Triana. Please call me Zizi. For this night, I am as moderator from Mediafisio.id. How are you, Prof?
Okay, baik saja.
Okay. Dr. Ahmad Munir is a senior lecturer at the Lifestyle Science Cluster at Advanced Medical and Dental Institute, University of Malaysia. He received his Bachelor and Master of Science degree from Indian University in Exercise Science in 1994 until 1993. Respectively, he completed his doctoral studies in exercise and sport science at the University of Sydney in 2005. His primary research interests includes environmental physiology, where he had examined the influence of relative humidity in the development of heat stress and its effect on sport performance. Okay, Prof. Please, this time is yours.
Okay, thank you, Zizi.
Assalamualaikum,
Selamat malam. Thank you again, and my apologies for the technical issue tadi. So basically, first and foremost, I'd like to thank the organizing committee for arranging for this and allowing me to share some information berkenaan regarding exercise for metabolic syndrome. As you mentioned, I'm a lecturer in USM, University of Science Malaysia in Penang, and we have a program at a master's level in clinical exercise science. So basically, it's a program where we train people that will be going out to work with clinical population in regards to prescribing exercise for the clinical population. So tonight, my topic is effective exercise for tackling metabolic syndrome. And so basically, metabolic syndrome, as defined by International Diabetics Federation, can be looked at either by looking at obesity when you measure central obesity or waist circumference, and also you can look at BMI. So anyone with a BMI over 30 can be categorized as having a metabolic syndrome. At the same time, okay. At the same time, metabolic syndrome can also be looked at in terms of assessing your triglyceride, which is lipid profile, which is either you look at high density lipoprotein, looking at having hypertension, or plasma glucose, looking at diabetics. Okay. In regards to metabolic, so basically metabolic syndrome is the best understanding of metabolic syndrome can be looked at as anyone having obesity issue, having cholesterol, having high triglyceride, having diabetics or insulin resistance, and having hypertension. So this is sort of also mentioned as non-metabolic disorder. In Malaysia, if we look at newspaper report, in Malaysia, the biggest issue now at the moment is about non-communicable disease or metabolic syndrome, which covers Malaysian having very high rate of obesity, very high rate of diabetics, cholesterolemia, and also hypertension. But when I look at Indonesia, for example, I noticed that Indonesia, in terms of obesity, not as high as Malaysia. Malaysia 44.2%, while Indonesia is on 21%. But the issue of childhood obesity is still one of the main issue in Indonesia. That you can see the paper clipping there from the ASEAN Post showing a child having a very high, having a very severe obesity. There's a paper that I read through about metabolic syndrome in Asia Pacific, and Malaysia had, as you can see from the statistics here, Malaysia has very high, about 37.1% of population suffering from metabolic syndrome. Unlike Indonesia, unlike Malaysia, Indonesia, from this paper published recently, I think this was published in 2019, the prevalence of metabolic syndrome in Indonesia is about 21.6%, still lower than Malaysia, but about the same as other Southeast Asia countries. This paper published in Public Health BMC journal looked at metabolic syndrome in regional. So they found that Jakarta, West Nusa Tenggara, West Sumatra, East Java, some of the province yang tinggi metabolic syndrome. And if you look at the metabolic syndrome components, in Indonesia, having low HDL cholesterol, which is the good cholesterol, 66%, hypertension 64%, and obesity 43%. So I think in Indonesia is slightly different to Malaysia. Malaysia is more obese, but in Indonesia is more toward the high cholesterol and hypertension. But Malaysia and Indonesia share the same issue of metabolic syndrome on the rise. So basically, in Malaysia, like any other country, we have our own strategic plan how to tackle the rise in non-communicable disease, which includes metabolic syndrome. Like this is the one before is in Malaysia. This is Australia, also have a blueprint of Active Australia, because a lot of the issue relating to the increase in metabolic syndrome is because of physical inactivity. People are not becoming active, especially now with the COVID situation. People are stuck at home or unable to go out as usual, resulting in a lot of people becoming less active. So in Malaysia and around the world, we have been following initiative referred to exercise as medicine. This is an initiative brought by the American College of Sports Medicine, whereby they look at exercise as a tool to improve your health. So rather than giving more medication, more drugs, now physicians and health care is looking at how we can use exercise to improve the condition of health within our population. Okay, so if we look at exercise prescription, generally for clinical population, and tonight, because we are looking at metabolic syndrome, which is basically a general looking at diabetics, obesity, hypertension, and cholesterol, there's a lot of research and a lot of publications to look at exercise guidelines. The one on the left is published by American College of Sports Medicine, Exercise and Diabetics. And the one on the right is published by the Australian Exercise Sports Science Australia, specifically on diabetics, so type 2 diabetics. The one and some more articles. This is a guideline to exercise for hypertension and also exercise for cholesterol, which is lipid. So from all these publications, generally secara amnya, when we talk about exercise, at what intensity and how the mode of exercise or what type of exercise I can do and duration. So these are the 4 main questions. So as you can see from this table, the top 4 components are covered in all the guidelines. So basically, any of the guidelines, the paper, when you look at frequency, all of the health organization recommend that we do as many days as possible of exercise intervention. So if you look at World Health Organization, they would recommend that you do as most days of the week recommended. But if you look at American College of Sports Medicine, they say as 3 to 5 days, but some organization will try to get it as many days possible. In regards to intensity, we'll go further, but at the moment, intensity, generally we will say moderate exercise. For clinical population, we always start with moderate exercise that they can tolerate. And when you look at the type of exercise, majority of exercise that deals with intervention for clinical population, especially metabolic syndrome, will cover aerobic and muscle strength. So basically exercises that will enhance the ability of your blood to supply oxygenated blood to your working muscles, and at the same time exercises that promote build up of new muscle tissue and increase in muscle strength. When you look at duration, duration varies, but generally we recommend up to 300 minutes a week. So if you're looking at exercising for 6 days or 5 days or 3 days, then you will need to accumulate those number of hours or duration of minutes in that 1 week. So this is a table that will give you an overview of the exercise. The question of what and why exercise for metabolic syndrome. So basically, this is the question that when my team and I here in USM, when we deal with our clinical exercise clinic, people come in, the first question they want to ask is what kind of exercise and why I have to do that. So basically, I hopefully tonight we can put new insight to that. More specifically now, when you look at exercise that we provide for clinical population, especially for metabolic syndrome, as I mentioned to you, the top 2, aerobic and resistance training, are the main component of any exercise program. However, when you look at metabolic syndrome, till today, a lot of emphasis is given for aerobic exercise first, while resistance training is also done. Maksudnya meaning the priority is to enhance your ability for the heart to supply oxygenated blood to your working muscles. This is the top priority first. And once you achieve this, then you start to build up on the resistance or the muscle strength. So when you look at aerobic per se, the intensity of exercise, as I mentioned, is moderate. So moderate exercise can be determined in many ways. One is if you have facilities to measure oxygen consumption. If you don't have facility to measure oxygen consumption, then we look at heart rate. So heart rate training zone. So we can go for between 50 to 40 to 50% of heart rate reserve, or about 50 to 60% of max heart rate. That is the intensity that we want our client or our patient to exercise. And when you talk about exercise, what kind of exercise, what type of exercise, it varies between individuals. So if you're looking at clinical population, we would recommend exercise of a non-weight bearing exercise. Non-weight bearing is basically like swimming, cycling, before you would consider to do weight bearing, such as jogging, walking, because weight bearing exercise for individual who are obese, individual who is hypertension, individual with diabetic that has neuropathy, sensitivity to the limbs, this can be counterproductive for them. So we would always recommend to start on a non-weight bearing exercise. Duration of exercise, we would recommend to do at least 30 minutes per session. However, how you do that 30 minutes depends, because it can be done in an interval mode. Interval mode means that you would have your client perform 5 minutes interval, 5-minute exercise, and you rest for about 2 minutes or 3 minutes. Then you do another 5 minutes. So rather than doing a continuous prolonged 30 minutes non-stop, clinical population is more tolerance to having a shorter interval, maybe 5 or 10, and then rest, and then do another 10, rest, do another 10. So because at the end of the day, when you look at the impact or effect of exercise, interval training and continuous training has no difference, meaning that if your client do 10 minutes and rest, 10 minutes and rest, and another 10 minutes, the benefit is the same as doing continuous. So in clinical population, the one that we practice in our clinic is we would promote to do interval training. And when you look at progression, we will always try to progress, trying to get patient to do up to 30 minutes before we increase intensity. Once we have achieved that 30 minutes, usually we increase to about 45 minutes before we go back and increase intensity. So that is more to aerobics. We will discuss this further. Maybe you have more questions after this. But when you talk about resistance training, the main aim of resistance training is to increase the muscular endurance, meaning that we want to enhance the ability of our patients to do multiple contraction, like daily work, without getting fatigued easily. Rather than we want to focus for them to increase maximum strength. So for example, when we work with our clients in the gym, doing arm curl, for example, all right? So maybe you can see arm curl. Rather than focusing on increasing heavy weights, we would increase the load on a more moderate, but increase the repetition. So basically, we want a client try to aim to be able to do work at least 10 to 15 repetition. So we always focus on increasing the endurance before we're going for the strength. And with range of motion, because this is something with the muscle as well, increasing the flexibility and avoid muscle stiffness, we will always promote for the flexibility or by doing stretching. So when you look at the prescription of exercise, it looks very simple, but when you look at dealing with clinical population, it is challenging because the tolerance of exercise for clinical population is more challenging than normal individual. For example, we have our patient in our clinic, for example, who are obese and have hypertension. So meaning to say that their tolerance of exercise is drastically reduced because of the excess body weight will result in them having more energy required to do the exercise. So what we want to do at that level is we would always start slow, gradually increasing the intensity of exercise. And we have to be careful because if we do the exercise in if exercise is more challenging, then the tendency patient will terminate exercise and will no longer be active. So this is part of the discussion tonight. How do we come up with new innovative approach to exercise for the clinical population? But before we go to the innovative ways, what we already established, exercise for metabolic syndrome provides a lot of benefit. We are going to look into the acute effect and also the chronic effect. Acute effect means that by doing one bout of exercise, one time they come in and exercise, what effect will you have? Physiologically, you will see those effects, the one you see on the screens. Improve blood glucose value. This is very important, especially for diabetics population, because when you improve your blood glucose values, you will avoid being fatigued early, because the tendency for people who is diabetics, they will easily go into hypoglycemic, drop blood sugar level, so people will not be able to exercise. So in our clinic, for people who is diabetics, we will always start them with low exercise. That one bar exercise is always at a low to moderate level. As they do that, they will improve the tolerance or in insulin sensitivity. This will result in them not utilizing glucose rapidly and avoid from going into hypoglycemic. And exercise also sustain post-exercise blood glucose controls. Post-exercise, after exercise, the tendency people with diabetics, after exercise, they will go into hypoglycemia as well. So we don't want that. And exercise, aerobic exercise, especially aerobic exercise, has been shown to improve the blood glucose maintenance during and post-exercise, more to aerobic. While resistance training also provide benefit, but more to aerobics. We also reduce hepatic glucose production and increase muscle glucose utilization. So all this is basically enhancing the efficiency of glucose utilization. If you look at on the last point of increasing high density lipoprotein, this is a good fat. HDL is a good fat. So what we notice, acute exercise can also promote increase in HDL. And this increase in HDL with exercise for the cholesterol level, it will be elevated post-exercise. Meaning to say, if you want to promote good fat from exercise, you need to do it more frequent, because HDL will increase after exercise and remains elevated up to 72 hours, between 48 to 72 hours. So basically, after exercise, your HDL will be elevated. That's good. But if you don't exercise after that, let's say you only exercise once a week, what's going to happen? With that one bout of exercise, HDL will increase, but then since you don't exercise anymore after that, it will go back to baseline. We don't want that. So what we want to promote is after doing one bout of exercise, within 48 hours, you will do another bout of exercise. So that will promote having the increase in HDL in your body. Aerobic exercise also improve blood pressure responses from a chronic, but acute, not so much. So when we look at this is chronic effect. Chronic effect is basically if you do multiple times. So usually from a training effect. A training effect can be up to 4 to 6 weeks, okay? So if you have clinical population engaging in your program for about 4 to 6 weeks, you should start to see these benefits. The benefit include improve overall metabolic control, which is your blood glucose and insulin sensitivity and resistance. You will also improve blood pressure control. This is due to ability of your blood vessels to vasodilate, decreasing the peripheral resistance in your blood flow and reducing the tension or hypertension. You will improve blood lipid utilization, meaning that you will start to utilize fat, which is good for reducing weight and also reducing cholesterol. Obviously, by doing aerobic exercise and resistance training, you can also start to see weight loss. This is pending a good nutrition, because sometimes we exercise, but then you don't take care of your diet, so you still have that weight issue. Of course, psychological and social well-being is also being recorded. People feeling better in terms of their overall wellness, and at the same time reducing the risk of type 2 diabetics for the risk. For example, we have people in our lab, in our clinic, who are obese, overweight. but they are not diabetics. But obviously, if they do not take care of themselves, they might be diabetics. So these are basically the benefit. So basically, like I said, our lab or our clinic, we always start the approach of start low, go slow, stay alert, or observe. Because start low means that you will start at a level that the patient can tolerate exercise, and you will progressively, slowly progress to higher level. Higher level can be increasing duration, followed by increasing intensity. And especially in clinical population where it's high risk, for example, hypertension or having diabetics, these are high risks. So we have to make sure that the exercise is tolerable and without any counterproductive effect to them. Okay, this is basically the last section of the talk. I've mentioned to you about all the studies done. I think you all are quite familiar. I understand that most of you are physiotherapists. So basically from the guideline, it's quite general, and I think everybody knows that. But if I were to ask you why there is still increase in all this metabolic syndrome in the world, not just Malaysia, Indonesia, South Asia region, but in the world, there's still increase in obesity, there's still increase in diabetics, cholesterol, hypertension. One of the reasons for that is people are still not active. And another one is the ability for people to sustain in an exercise program is low, meaning to say that people might come in and join an exercise program or engage in an exercise program for maybe a short time, maybe a few weeks, and then they pull out. So basically, it's not sustainable. One of the reasons why exercise program is not sustainable is because exercise was wrongly prescribed, meaning the exercise was too hard for them. And the other one is exercise was not fun, because sometimes, I don't know about you guys, but you may experience, some of you may want or may like to go to the gym. Some people may not like to go to the gym and rather exercise in an outdoor environment, maybe play sports rather to go to the gym and run a treadmill. So these are issues that why people are not still challenging in terms of exercising. So what is the innovative approach to exercise? I like to share with a program that's being done by my colleague in Australia and Singapore. They call it walking football. This is a project by my colleague in Australia and also in Singapore, where they promote exercise from a game point of view. What game? Soccer, because soccer is very popular in South Asia, isn't it? I think Indonesia pun quite popular. So as you can see from the picture, you can see that older people, right? Older people. In USM, my team and I did a project, not so much older people, but we did a project on obese people. So rather than playing a full-size soccer field, we play a small soccer field. We call it small-size soccer field. So in that game, we are still promoting people to move rather than running, but they can still move and jog in a small field. So indirectly exercising, and without realizing, they are working at a heart rate which is quite high, as similar if they were to go to the gym. So in a way, it's a recreation kind of activity. So and I mean you can go and search more articles, but soccer, they call it small-sided soccer, has been very popular, especially in the Scandinavian country. You can see the article there. Recreational soccer is an effective health promoting activity for untrained men, by the group in Sweden. This is Professor Jans Bangsbo in Stockholm. Where they basically use soccer as a way to promote health in exercise. Okay, this is a project that we did in USM, promoting weight loss via futsal among untrained men. These are overweight individuals. So what we found, basically, they play twice a week for 12 weeks in a 15 by 30 meter soccer, small side soccer. They play outdoors, which is basically warm and humid, and they play in the afternoon, 5:30 to 6:30, 1 hour session, but basically it's a 15 minutes, 3 intervals. So 15 minutes and then they rest, 5 minutes rest, they play another 15 minutes. So basically they play 45 minutes with 5 minutes rest in between. And what we found is basically, we can see pre and post. So we found that after post, there is reduction of about 84.7%, 84.7 kilo, so about 3.7 weight loss, reduction in percent body fat, reduction in BMI. So all this shows a positive effect in terms of weight reduction. They were not hypertensive patient, so they were about 130, not so high, not hypertensive. But we found that there was changes in the lipid profile, so HDL and LDL, and also, so basically by doing that exercise, we found that our subjects or our individuals were able to lose weight, and indirectly also exercising at the heart rate. So basically, in playing soccer, without them realizing, their heart rate is about 70% of the maximum heart rate. So they are actually training at about 60 to 70% during the 12 weeks of program. So basically, what we found from this particular project is futsal, soccer, small-sided futsal, where we make it a smaller field. Smaller field will require them to move, even though they don't have to run. That movement during the game was enough to elevate the heart rate and give them the positive effect of exercise. So that's one innovative way. Basically, you would simulate a game for them to play without having them to exert to the maximum. At the same time, another innovative way is basically training in the heat. We live in a hot and tropical condition, right? Indonesia is the same thing. So basically what we found was studies have shown that if you exercise in the heat, you would increase your aerobic capacity much larger than exercising in the neutral condition. So basically contohnya, if I were to go out and run outdoor, okay, as compared running indoor in aircon room, which condition will give me better stimulus for improve in my aerobic capacity running in the heat? So basically, with this understanding, we now know that when you have exposure to the hot environment without having hyperthermia, you have to understand that I'm not suggesting that you go out running at having your clinical population run when it is like satu petang 12 tengah hari, afternoon, very very hot. No. So they would have exposure maybe in the later afternoon. So basically, increasing the heat will also provide stimulus for improving aerobic capacity. So this is one of the earlier publications from the US back in 2010. So what they found is basically, if you look at this graph, this is VO2 max, all right? So what we found was when they train in the cool, and then you can see that before and after training in the heat, there's improvement in VO2. When they exercise in the hot, also there's larger improvement in VO2. VO2 is basically maximum oxygen consumption, showing that they are increasing amount of oxygen consumption of VO2 max in the heat after training in the heat. So basically, they found that it's better to have some exposure to exercise in the heat. In the heat is 38 degrees Celsius, but this is dry. So like in Indonesia, I think that in Malaysia, 32 degrees Celsius and 60 or 70% relative humidity is quite normal, okay? So basically, what they found from that study is basically 10 days of heat acclimation provide considerable ergogenic benefit in cool condition. In addition, heat acclimation provide expected performance benefit in hot condition. Basically, you would improve your glucose, reduce your blood lactate, improve plasma volume, improve myocardial efficiency, increase ventricular compliance. So basically your heart function is further enhanced when you are exposed to some level of heat stress. So how does it work in terms of heat stress? If you look at this diagram, so basically when you have stress, which is the environment, and then you have disturbance to homeostasis. So basically when you have changes in the environment, it's hotter, then what's happening is that your body temperature is elevated. When your body temperature is elevated, your heart have to work extra harder. So basically the response when you have disturbance to homeostasis, the heart will have to respond. So what is the response? Your heart must be elevated. So this is adaptation. Okay, adaptation means that your body will need to work extra hard to adapt to the new environment. Maladaptation is if your body cannot adapt and it goes into injury or illness. So we don't want that. So how do we avoid that? So basically in the heat, you don't exercise in extreme heat, or you don't exercise when you are not fully hydrated. So in the clinical setting, you have to make sure that your subjects are fully hydrated. You have to make sure that when you talk about training and the heat, they are also providing, the condition is not severe, and they are also having the opportunity to cool off after training. So with this understanding, it basically means that what we're doing now is based on this study, or this understanding. Dress for the heat. This study that was published in 2018, quite recently, a study was published, done in the US, in Seattle, if I'm not mistaken, by Eli and the group, where what they did was, now with the understanding that if you have some heat adaptation or heat stimulus on your body, you would increase the heart and you increase the physiological response. So this increase in physiological response is good for adaptation, for aerobic adaptation. So what they do now is they would put people to wear clothing, so that they will have clothing insulation. So in this study, they have people exercising in a hot environment, 40 degrees Celsius, dry, with minimal clothing. That means not wearing too much clothing, and in temperate environment, and with overdressing. The other one's overdressing. Overdressing, that means they wear like a sweater, cover everything, tangan panjang, okay, cover everything. The other one, they just wear singlet, right? And then they exercise. They train these people to exercise in the heat. So what they found is that people who overdress, wear sweater, long sleeve, insulation, people who overdress and exercise in the heat will end up having higher body temperature, higher skin temperature, higher heart rate, higher sweating. This adaptation, especially higher heart rate, this adaptation results in subjects being able to improve their aerobic capacity better than those who is not exposed to heat stress. So with this understanding, what we are doing now and what's being published in other labs as well, we are now working with people who, for example, people who has got people who's got hypertension. They cannot do exercise at a high intensity, because the moment you do high intensity, it will create tension. Your blood pressure rises, right? So you always have to do very low level of intensity. So if you do low level, the adaptation is minimal, isn't it? Right? So what we want to do now is, while you do low level intensity, but we ask them to wear insulation, because the heat will give them additional stimulus while they exercise at low intensity. I hope you understand the concept. So now in our lab, we are promoting exercise with having some level of adaptation to the heat. Now, what we do, if basically they wear sweater, they do light exercise. If they feel very, very warm, so basically they unzip, so that means some air will come out, and then they continue to exercise. So basically we are now promoting to have some level of heat stress during exercise for our client. a level of heat stress can also be experienced by not just clothing, but hot water immersion. So basically, hot water immersion is when you have your client or your patient immersed in hot water after exercise. Okay, because after exercise, with immersion in hot water, you would still promote circulatory adaptation. That means your body is hot, so that will also push for the cardiac function and provides the what you call avenue for increase in adaptation for the cardiovascular adaptation. So this is one study where after exercise they will immerse themselves in a hot condition. So this is the trial. So basically the design is basically people will exercise before 3 days before the exercise, and then on the day of testing they would do exercise 65%, and then they will immerse in hot water 34 degrees Celsius for 40 minutes. This is the hot water, this is control, is hot water immersion. Hot water immersion at 40 degrees Celsius. So the water is at 40 degrees. After exercise, they will immerse for 40 minutes. So what they found, for those group who did this, after exercise, immerse, they found that the ability to exercise and the improvement for aerobic capacity is much greater. So basically now we are basically promoting hot immersion or hot water immersion or passive heating after exercise as a tool for adaptation for our clinical population. Another one is, like I said, passive. This is what we call body perfuse suit. As you can see, this is a trial where the researcher is putting a jacket on. This jacket, all this tubing, this is tubing. So water goes inside here, this tubing, and this is hot water. So basically, while wearing that suit, you elevate your skin temperature, and the elevation in skin temperature will result in our body to be warmer and again promoting cardiovascular responses. So again, client don't have to do very high intensity, can do low intensity, but induced by passive heating, and that generates greater adaptation for aerobic improvement. So that is heat, which is the second way that we've been doing, innovative way that we're working with our client. The last one is more recent, is eccentric exercise. So basically eccentric exercise, I'll try to go this quickly. What we mean with eccentric is basically, if you look at this diagram, when we do muscle contraction, eccentric is by definition is lengthening of your muscle. So when you do this exercise, arm curl, as your movement going up, you curling up, your bicep is actually shortening. Okay, so this is called concentric, because shortening of a muscle. But the movement downwards, okay, is lengthening. You are lengthening your muscle. This is called eccentric. So any movement where we are lengthening our muscle is referred to eccentric. So most of the eccentric studies or projects in the past have been carried out in the resistance mode. Maksudnya, they go to the gym and do resistance training. But more recently, we are doing exercise with dynamic, which is movement like cycling, but eccentric manner. Okay, so this is the equipment that we have in our lab that we do research. This is eccentric bicycle. Unlike normal bicycle where we pedal like front, right, going front, but eccentric is you are cycling backwards and controlled by the motor here. Okay, I will show the video. This is the video. I hope I can play this. Can you see the video? Okay, can I just ask? Can you guys see the video?
Yep. Yes.
Okay, I just
Yeah.
ulang. Okay. Okay, so basically now, from the video you saw tadi, basically you saw the subject was pedaling backwards, right? So this subject here, he's involved in our study on lipid metabolism for overweight people. So he was cycling at 110 watts, okay, and his heart rate was only about 97 beats per minute. So basically showing you guys that eccentric is a way of exercise without inducing high level of cardiovascular stress. So on that note, we are now doing a study, a PhD study. This is my student, PhD student, where she is looking at how eccentric dynamic exercise affects lipid metabolism among obese individuals, and we're testing them in a neutral condition and later on in the heat stress environment. So why we are doing eccentric, and this is why I say as an innovative way to exercise in the future, is because eccentric exercise has been shown to be more metabolic, less metabolic demanding, meaning that it is less stressful because your heart rate lower and you would require less amount of oxygen. So basically, this is an exercise where you would feel less stressful, but you would gain more in terms of strength. Okay, so doing less amount of oxygen, but you increase amount of strength. So on that note, eccentric exercise has been adopted in more recently within the last few years as a new mode of exercise for clinical population. Reason being because for clinical population, you don't have to exercise them at a very high intensity, but they get the benefit much more than the normal concentric exercise. So this is like I said to you before, when you look at muscle force and you look at metabolic cost, you look at eccentric, more muscle force, but at a lesser metabolic cost. So if you look at any level of metabolic cost, okay, same metabolic cost, but the muscle force is greater. Okay, same level of metabolic cost, but greater muscle force. So this is very good for eccentric, for clinical population. This is a study done a few years back, 2013, where they compare. This is dynamic, the one I showed the video tadi. They cycle concentric, and they do eccentric 1, eccentric 2. What is eccentric 1? With eccentric exercise, what you saw the guy cycling tadi, if you do it first time, you will feel very, very sore after, meaning that 24 hours after the first one, you will feel very sore, okay? What you need to do is you would need to exercise after that, meaning that if you do repeated bout of eccentric, you will avoid the soreness, okay? So what we found from previous study, when you do concentric exercise, normal exercise, look at the oxygen consumption, 2.5 liter. But if you do eccentric, the oxygen consumption is much less, meaning that you would require less energy to do the same thing. You look at the heart rate is much lower when eccentric compared to concentric. So because of that, nowadays, more and more studies using eccentric as a way for clinical population. One, because eccentric exercise has been shown to use more fat than carbohydrate during exercise. So it's very good for people who want to lose weight, okay, to do eccentric exercise. In this particular article, where they look at eccentric in terms of health promoting, they found that if you do eccentric exercise on a weekly basis, you would improve your health. Improve health in terms of you improve your lipid profile, you improve your glucose insulin sensitivity. So that's very good. And then also on top of that, you will also promote weight loss. So this is why eccentric exercise has now been very, very popular among clinical population. Again, another article about eccentric to lose weight and metabolic adaptation. So I think with that, I cover three main things as innovative ways to exercise. One is basically looking at using sports recreation kind of thing approach for exercise. The other one is to look at heat, to use heat as a stimulus for further enhancing aerobic adaptation, which is very important for metabolic syndrome population. And the last one is ongoing research that we're doing now with eccentric to look at improving lipid metabolism as well as other metabolic responses during exercise. So with that, I hope I have made some points across for us to discuss, and I'm now like to pass back to the moderator. Thank you.
Okay. Okay, thank you. Thank you, Prof. Ahmad, for the amazing material for this night. Well, now we start the question and answer session. We have 4 questions for. Okay, wait. Okay, the first question is from Hastutik Munir Asih. The first question is intensity exercise that is most effective to do throughout the life cycle from a young age to the elderly. It is necessary occasionally with high intensity, then the exercise that is mean in overcoming metabolic disorder is aerobic exercise.
Okay. So basically, thank you for the question. Very good question. This is the main issue with prescribing exercise for the clinical population. But your question wanted to know from young age to the elderly. So obviously, in general, I would still recommend that the approach is exercise from the low to moderate. Why? Is because the main aim of exercise in terms of health purposes or improving health is to increase the level of tolerance for your heart to pump blood to the working muscle. So the priority is given for at least to moderate or moderate high or across the board, meaning that from young age, especially for young age, depending kalau children, kanak-kanak, you always have to understand kalau kanak-kanak, heart rate is always high because their heart rate is very high. So we want to make sure that the intensity is quite moderate. As you increase your age, you can go moderate high, but you have to be very careful in terms of each individual circumstances. Contoh, if for example, sekiranya orang dewasa, 50 years old or 60 years old, but has no problem, has no diabetics, has no hypertension, meaning that their risk is lower, isn't it? So when the risk is lower, meaning that you can go to moderate to moderate high. But if there is a risk, let's say hypertensive, and it is older population, obviously you have to start to go back to low. If you want to overcome metabolic disorder is always focusing more to endurance, meaning that it is more prolonged. So rather than focusing on high intensity, you would want to have moderate, but can try to do up 30 minutes or 45 minutes. Am I clear? It's like a voice. Can you guys hear me?
Yes.
Okay. So basically, if metabolic disorder is still looking at moderate to moderate high, okay, you can do high intensity. Yes, definitely you can do, but depending on individual. I hope I answered the question. Has to take.
The next question from Adriana Lintang.
Okay, there are two parts. There are two parts here. So basically, if you have this situation, mentally impaired balance, the best will be a non-weight cycling, non-weight bearing, but incline bike, one that you can sit down rather than incline bike, incline bicycle. So it is more stable, and that will also reduce the cardiovascular stress during exercise. So incline bicycle, or they call it recline bicycle, recline bike. In terms of the percentage cure prognosis metabolic syndrome with various exercises described, I'm assuming. Oh, okay. Basically, persen sembuhan. So basically, if you were to do this program, it's been shown any exercise between 8 to 12 weeks will start to show improvement. So improvement, for example, you will improve aerobic, you will improve circulation, and also you improve the metabolic issues. Okay, so therefore, in terms of sembuhan, prognosis kesembuhan, there is a good chance they will sembuh. However, you have to understand certain disease, diabetics, considered non-reversible. You've got diabetics, you cannot go back to not having diabetics, right? It's not reversible. But you improve the disease. So people with diabetics, for example, if you are on insulin, for example, if you do exercise, you will reduce the dependence on insulin. So there is a very high percentage of cure or improvement in the health.
Hi, Prof. Good evening.
Hi, Jonathan.
I'd like to ask probably a few questions about your material. Firstly,
Yes,
the evidence that you given.
Yeah.
Excuse me?
Yes, please. Your question?
From the paper that you've given, heat environment, because it's the sample was on athlete, the runners. Is it applied to metabolic people who has metabolic syndrome?
Okay, I heard the first question, but the last eccentric one I was breaking. Let me answer the first part first. The first,
it was given to a runner, right?
Yeah.
And then it could be applied to people with several metabolic condition.
Okay, thank you, Jonathan. Good question. There are studies. The one I showed you was for athletic population, but from that understanding, there are studies that have used heat adaptation for clinical population. Basically, what we are doing, we still in our clinic, we still have exercise at a moderate intensity. For example, you do 50 to 60%, not high, 50-60%. And when you say about increasing you would increase the body temperature, not so high. For example, in our environment of 30 degrees Celsius, that means your skin temperature is about 30 degrees Celsius too, isn't it? But then when you wear clothes, when you wear pakaian, it can be up to about 33 or 34 degrees Celsius. So basically, the concept of adding heat to clinical population is the same, but the intensity is much lower and duration is also lower. For example, we do 5 minutes rest, 5 minutes rest, 5 minute rest. In fact, there are evidence to show about the use of for people in cardiac rehab, because they want to increase the adaptation of the circulatory system, they provided heat, passive heat to cardiac rehab patient. Okay.
Yeah, the second question was about eccentric contraction that you have given to us, the video and then the example. My question is, how about functional training, which is contain isometric, eccentric, and then concentric contraction that can be varies rather than just only give eccentric contraction. What do you?
Okay, there's nothing wrong with the previous approach of doing functional training, which is fine. The reason that if we pick only eccentric is basically evidence that it is less metabolic cost. So basically, if you compare eccentric and concentric, it was clear. That is at the moment not disputed. You do eccentric, the cycling one, it is low metabolic cost. The screen at the end of the video, you can see the screen. He was doing 110 watts and his heart rate is only 97. So if he would do to the concentric cycling at 110 watts, his heart rate will be about 130 beats per minute. Okay, so basically, if you ask me, okay, does it mean that I cannot do other? No, you can still do it. But if you have the equipment, if you have the way of doing eccentric, we promote eccentric, especially for those that has low tolerance to exercise. But even for me, Jonathan, I don't consider myself active fit, but I'm active. So if I do I do cycling eccentric because one is less stressful on my heart because my heart is lower. But in terms of muscle, because of the eccentric mode, my muscle is working as hard as more harder than concentric. So basically, I get two. I get less stressful cardiovascular, but my muscles are working extra hard. So as if like I'm doing very easy work, but my muscles are stronger. So now, eccentric, if for example, you saw the video, I have got the equipment, but in daily life, eccentric is basically if you go downstairs, if you're walking down, turun tangga, descending is eccentric. So some places, they promote people take the stairs, right? Guna tangga for kesihatan. So what we can do now is basically, if you want to go up, never mind, you take the elevator. But coming down, you do normal because that is promoting eccentric. So less stress, but more muscle, more working on the muscle. So I mean, I'm not saying functional tak boleh buat. Okay, no problem, you can do that. But if you do eccentric, you get 2 in 1. Less stress, but more work on the muscle.
Okay, is it clear? Is it clear, Bang? Please unmute your voice.
Okay, so now this is question by Yasmin.
Thank you, Prof.
Yes, question by Yasmin. Is it safe for our metabolic system to do exercise during fasting? Oh yes, of course. With fasting, any guideline that you read about fasting, we've done studies on fasting as well. Fasting exercise, we promote exercise either in the morning or late afternoon. So that has always been the practice for us. Even we play soccer and everything, no problem. So usually in the fasting month, the first week is the challenge because the body is adapting from the metabolic changes, right? You don't have the energy. But second to third week, you have adapted. So usually, if well-trained people, they can still continue to exercise in the afternoon. But itu well-trained kalau sports. Kalau normal individual pun, we still promote to be active, but basically in the afternoon. So ada orang yang I do exercise at night, kan? Our rituals ini, for example, lepas berbuka puasa, we prayers, and then after prayers, people go to the gym, can, no problem. But yes, it is safe to do exercise during fasting. But again, depending on the tolerance level lah. If you got diabetics, for example, don't exercise too hard in fasting because you might be in a very high risk of hypoglycemic.
Okay, thank you, Prof, for the last answer. Okay, I think this time is enough. And once again, thanks for sharing with us, Miss Professor Ahmad. And okay, dari paparan diskusi malam ini dapat bahwa metabolic syndrome dapat dipengaruhi oleh adanya peningkatan tekanan darah, peningkatan glukosa dalam darah, dan obesitas. Dari diskusi malam ini, kita menyimpulkan bahwa exercise dapat mengurangi metabolic syndrome karena exercise dapat mengatur metabolisme lemak dan glukosa, sehingga bisa meningkatkan kerja insulin dan menurunkan tekanan darah, terutama pada seseorang yang mengalami obesitas. Dari diskusi malam ini juga, kita dapat simpulkan bahwa exercise yang paling highly recommended untuk metabolic syndrome adalah tipe eccentric exercise karena bisa menurunkan more or less stressful level and bisa meningkatkan kerja otot yang lebih baik. Oke, terlepas dari ini semua, kita harus juga harus melihat durasi dan intensitas latihan yang tepat untuk kita desain untuk ke pasien kita. Seperti latihan bisa dimulai dari low intensity, slow, and stay alert. And always check heart rate after 5 minutes if you give the exercise to your patient. Sekian dari saya, mohon maaf jika ada salah kata dan perbuatan. Terima kasih atas waktunya pada kesempatan kali ini. Thank you for the material, Prof. And see you at the next sharing session with Mediafisio. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Saya kembalikan kepada Hani selaku host pada acara ini. Thank you and see you.
Baik, terima kasih kepada Profesor Ahmad Munir bin C. Muhammad selaku pemateri yang sudah meluangkan waktunya dan sharing ilmu kepada kita semua, serta moderator Saudari Zizi Triana, dan terima kasih juga untuk para peserta yang sudah berpartisipasi pada webinar hari ini. Sekian untuk webinar kita pada hari ini. Semoga apa yang telah disampaikan bisa bermanfaat untuk kita semua. Saya memohon maaf apabila ada kesalahan yang sengaja maupun tidak sengaja. Kita akhiri webinar kali ini dengan mengucapkan hamdalah bersama-sama. Alhamdulillahirrahmanirrahim. Sekian, wassalamualaikum warahmatullahi wabarakatuh. Mohon maaf agar peserta dipersilahkan untuk on cam terlebih dahulu untuk diadakan sesi foto bersama. Terima kasih.
Dari saya ya, screenshotnya.
Oke.
Oke. 1, 2, 3. Bentar. Slide kedua. 1, 2, 3. Bentar. Slide ketiga. 1, 2, 3. Last slide. Slide terakhir. 1, 2, 3. Oke. Sudah semuanya.
Oke, terima kasih.
Okay, thank you, Prof.
Thank you, Prof.
And see you.
See you.
Nice to meet you.